Welcome to Own Your Heart Health. I'm Dr. Regina Druz, your holistic cardiologist. This week, we will dive into common heart health concerns, uncovering root causes, and unpacking scientific discoveries and controversies. The information provided does not constitute medical advice. Please contact your healthcare practitioner before making any changes that may impact your health. Hi, everybody. So we are for such a tremendous treat today. So it's a Friday. And as you know, Friday is a fun day. And Friday Fun Day guest with me today is extraordinary Dr. Sam Shay. Now, you may or may not know, but Dr. Sam Shay is actually a stand-up comic in addition to being a star functional medicine practitioner. And his particular area of interest is actually how humor can help us to positively impact our heart health and, I guess, chronic diseases in general. So welcome, Sam.
Thank you. I really appreciate you having me here. I came to stand-up comedy the usual way, which was through tragedy. And it's tragically, that is the trope for most comics. And growing up, I never knew my grandfather on my father's side, because he died of carotid artery disease actually on the operating table back in 1965. And he was actually one of the most famous gastroenterologists in the United States. He'd published over 300 research articles and was the founding director of the Fels Cancer Research Center at Temple University in 1937. And he died 17 years before I was born. And because back then, the theory was that angina, which is and claudication, was pain in the legs from walking. That they thought that was from a quote reflex arc from an inflamed gallbladder. They operated on the gallbladder, and he died on the operating table. And the coroner told my father, who was in the beginnings of his medical school career, that the carotid artery was so clogged he couldn't fit a pin through it. So heart disease meaningfully affected my family for several generations. And my mother, I'm also connected to the heart disease and cardiovascular concerns because my mother almost died from an aortic aneurysm back over 10 years ago. Luckily, she was also a medical doctor, and she felt tearing pain in the chest. Quick, better call my brother-in-law, which is a brilliant ear, nose, throat doctor. She called him, and he said, "You need to get to the hospital right away."
Now, right.
Being an aortic aneurysm. Fortunately, she was in Boston, and that's where arguably the number one team for dealing with cardiovascular emergencies like that lives. And even if you do get to the surgery in time, you only have a 50% survival rate, and she was in that positive 50% survival. So my connection to cardiovascular. My father has carotid artery disease at the moment. So this is a long way of saying, like, the topic, what you specialize in what you're educating, on your podcast is of deep interest to me. And then the convergence of that with humor is that laughter is some of the best medicine. And in the American Academy of Therapeutic Humor, the AATH has been around for about 30 years. In fact, Patch Adams spoke there back. 90s.
That's actually the first time. I have never known that there is such a thing as American Academy of Therapeutic Humor. It's extraordinary. Okay.
And so Patch Adams spoke there in the 90s. And in fact, I randomly sat at breakfast with the gentleman who invited Patch Adams 30 years ago. And he told me the whole story of how he invited Dr. Adams over there. And I keynoted there 2 weekends ago as of this week. I was the keynote 2 weekends ago tomorrow, actually, on Saturday morning. And I did my entire 1-hour comedy show called Neurospicy, Love, Life, and Comedy on the Spectrum. And what that's about is I have Asperger's syndrome. And what that means is that I have a different neurology than most people. And what that means is that I wasn't born with social software. I had what comes to people intuitively, I had to build algorithmically.
One by one.
One by one, and it just keeps going. And I have a theory that it takes about to age 30 to 40 for someone on the spectrum to achieve social parity in terms of masking to socially blend in. But because, I and people like me have had to build our social software from scratch, if we continue to add more and more algorithms and more pattern recognition beyond the age of 40, we can actually become, on the far side of our 40s, the most socially astute people, because now we can read all the micro.
You dialed in. You got dialed in.
And and just get more and more and more and more dialed in. And humor is one of the most effective vectors for social connections and vectors for truth. And I found that if I can make people laugh, I can communicate in a way that builds connection, but also can maintain the integrity of what's happening. Because as someone on the spectrum, I see everything as data, and I find it very bizarre that people lie, because why would you do that? But I had to learn the hard way that people do that. And so humor is and as I also to learn, like, not everyone wants to hear the truth kind of air blasted at their face.
Yeah, that's true.
At all times in a 5-paragraph essay with citations every time they say hi, and you just launch into whatever your special interest is, and they have no interest in learning about the nuances of dragonflies.
No.
But even though they're super cool, I actually have like 2 minutes on dragonflies in my set, because I'm making a point about, number one, how awesome they are, and two, about the point about special interests that people on the spectrum take interest in. They somehow don't want to hear about dragonflies, and I had to learn that the hard way. But laughter is its own generating laughter is its own kind of purity and integrity to it. And it also turns out it's really good for you. And that's where the American Academy of Therapeutic Humor, they've been at the forefront of trying to legitimize the science of laughter therapy, as opposed to being dismissed as some kind of, like, you're not a real doctor, you're just kind of wasting time with jokes. And that's not the point.
Hi, everyone. It's Dr. Regina here. I know there are contradictory opinions about nutrition for heart health and longevity. The discussion often gets heated and confusing. There are those who push for low fat, low cholesterol. Then there are fans of a ketogenic diet. There are many anti-meat voices as well, suggesting vegan or vegetarian style of eating. With all the chatter out there on what and how to eat, my team and I decided to create a tool for patients, medical professionals to clear the clutter. It is called Holistic Heart University, and it provides on-demand courses, nutrition and lifestyle resources, information on supplements to make it easier to understand how to make healthy choices for your heart. I'm especially proud of our open office hours for program patients and the Q&A feature where you get to ask your individual questions and put us in the hot seat. Head out to the show notes for the link and use my special promo code to get a huge 20% off on our annual health and wellness subscription. The code is OWNER20, and I'll see you in the office hours. Let me ask you a couple of questions, because this brings up sort of an interesting line, right? So serious events, right, in your family history, kind of some events quite tragic, and something that impacts the family dynamic quite a bit, stays with you for a long time, and you were able to kind of pivot, and use it as an inspiration to create this humorous and, more comical opportunity that is also a healing opportunity. So how does, and, the closest I came to it is the laughing yoga, and I've done it a couple of times, and I always find it so challenging because, they sort of like laughing on command is, it's sort of counterintuitive. So Could you explain then what are the therapeutic benefits of humor? Is it different from therapeutic benefit of laughter? Because not everybody is going to laugh. They could hear something funny, but they may not necessarily going to laugh. They could just think it's funny. And how does that actually helps us with some of the issues that we see cardiovascular all the time? And I can tell you that what I see all the time in our patients, in myself included, is that we are stuck in this perpetual sympathetic activation response, right? We are constantly on. We are, the heart rate is up, the blood pressure is up. There was even an article recently that was, I guess, advising clinicians to look at hypercortisolism, right? The high cortisol state. But of course, it was more of a traditional medical article. And so they were asking clinicians to learn Cushing syndrome and how to rule it out. And I know from my patient work, and I'm sure you do too, is that anxiety and this constant sympathetic arousal outside of the Cushing syndrome is actually very much tied in to hypertension, to tachycardia, to dizziness. It's not necessarily a panic attack. It's not a Cushing syndrome, but it is a factor. And I met many patients whose blood pressures will not budge until this sympathetic arousal is turned
Mhm.
off. Right. So what's been your experience, and what have you discovered and applied?
Yeah, so there's experience, and then there's the research, and I mean, there I can just name a research article right now called "Laughter." This is published in the Journal of Epidemiology in 2006, October 5th, called "Laughter is the Best Medicine: A Cross-Sectional Study of Cardiovascular Disease Amongst Older Japanese Adults."
Mm-hmm.
And it basically says if you laugh, lower prevalence of cardiovascular diseases, uh, and it cannot be explained by confounding factors like depressive symptoms. Like so, it's like laughter was uniquely like the thing,
Okay.
uh, and there's the way that laughter helps is number one. Laughter it helps get people out of the sympathetic nervous system and gets them out of the stress response. And you can see this in real time. You don't need a research study for this.
Mm-hmm.
When one of the things that a really good comedian, um, when I write comedy, and this is a writing tip for anyone who's interested in comedy. Bonus: never write for funny.
But right
Oh,
for what? Okay.
truth.
Right for
Write for
truth.
truth. You write for truth. That is one of the most important lessons in writing comedy I have ever learned, and I'm now passing on to the listeners here. You find the funny in the truth. You never find the truth in the funny. So the reason this relates to dropping sympathetic dominance and
Mm-hmm.
getting people out of stress is that if you think about any really good comic, you laugh the hardest when they name a thing that's true that's been unspoken,
That's true.
right? They
Yes.
name the thing. They name the thing that's like lingering in the air, like a bad
Yeah.
fart, and they name it. They name it the thing that's bothering people, but people are too embarrassed to name
Or too
explicitly.
afraid, to
They're
name
too afraid.
it.
They're too afraid, and when it's named, people laugh, and automatically the emotional temperature drops. The stress goes down, and that when you can deliver an uncomfortable truth with humor, now assuming like it's the right audience and it's the right timing, and it's like there's all these factors that got to tie in, but
Mm-hmm.
humor is a way to create to just dial down personal as well as social stress, because now the thing that is unspoken, that's gnawing at the mind, is now explicit. And now the anxiety of, oh my God, are they going to say the thing? And do people know the thing? Do they see the thing? Like that's now it's out in the open, and
Mm-hmm.
everyone's laughing, which is a signal of social acceptance of like, okay, we don't have to hide it anymore. We can handle the thing, and it's not so tense
So there
anymore.
is this communal quality, right, to
Yeah.
humor. So, like, would you get the same benefit if you're laughing like by yourself? Like you're
Well,
not.
the truth can be named that about a social issue or a cultural concern or a group concern or personal, and someone else, you can watch a YouTube channel of
Mm-hmm.
comedy, and your personal system will drop down. It would be your personal stress response will
Mm-hmm.
lower. It's better if it's in the group, but yours will still go down.
Mm-hmm.
I think it's more effective if it's in a group, particularly if the joke is about the thing the group is stressing about.
So, in the Japanese study that you mentioned, and I have to tell you that I actually recently traveled to Japan. That was my
Okay.
first time, and it's an amazing country. It has a lot of interesting things, and I really loved all the people we came in touch with because they were very open and very interested in learning more, learning who you are. But there is also a different mindset for a lot of people who live in Japan. I'm, specifically referring to people who are Japanese by origin. They're very spiritual. They sort of practice two religions at the same time. Buddhism and Shinto. They kind of, adjust them to whatever their needs are, and they're also very much in tune with nature, right? Nature plays such a huge role for their country because it's not a very big country, and it's essentially a series of islands. So the natural phenomena like typhoons and whatnot potentially affect them deeply. So Japanese are very respectful and also very mindful of nature. They have this mindset that nature is what gives us signals, and we need to go and do our forest bathing, and we need to worship at the shrines because that's our connection. So it's interesting, obviously, because it's cultural, and we probably don't have necessarily the same in other
Well,
countries.
you're not wrong for pointing it out that it was in a Japanese culture, but you can there are many U.S. based studies. I mean, literally the American Academy of Therapeutic Humor. It's built into the name.
Right.
That that every person who goes through their 3 year her certified humor professional, I think is what it's called, their 3 year program, they have to do a project
Uh-huh.
on showing the science around humor. And there's other institutions like University of Maryland Medical Center has studies they've done on watching comedy films and looking at improved arterial flexibility and blood flow after laughter.
Mm-hmm.
University of Texas at Austin looks at the comedy versus documentary and our artery health, and that showing that there's immediate lasting improvements in artery function after watching a comedy show versus a documentary. And
Interesting.
then there's also Harvard Health Publishing has and Beth Israel Deaconess Medical Center in Boston. They also gather a whole bunch of information on laughter and have their own separate studies that they've put together.
Interesting. So that explains my addiction to Netflix because, and some of the shows. But so, a couple of questions. So, how is therapeutic laughter different from just laughter in general? Like, is there a kind of like a sequence or a program that, we typically, let's say a patient with hypertension or a patient with heart disease, we would advise on certain nutrition, we would advise perhaps on medication, supplementations, exercise, some community engagement. What advice could we give with regard to therapeutic laughter? Like what would it be? Would it be like laugh 3 times a day, or like what does it look like actually?
So the difference is one's intentional and one's spontaneous.
Okay.
That's really, I mean, people can like drink water, but then you can be prescribed to drink more water because you're chronically dehydrated. And I think
Mm-hmm, mm-hmm.
that's the difference. And I mean, the therapeutic lab is a deliberate, structured intervention of humor as a daily practice into one's life. And
Okay.
that there are different exercises. There's lots of exercises that people can do, like whether it's laughter yoga or they have a specific type of comedy they put on that they watch for 5 minutes a day or a half hour a day. Like there's different protocols and guidelines, but I think the big picture that people need to that they can understand is just like one therapeutic laughter is the intentional incorporation of laughter as a daily practice. That's it.
Interesting. And so, what would you say is sort of the minimum amount of time that one can use therapeutic laughter, let's say intentionally, and still derive cardiovascular benefit? Is it like 5 minutes? Is it 30 minutes? Is it 50 minutes? Like how much do you think, what's the lowest amount that one can use and still get the benefit, assuming that they're doing it consistently?
It depends on what study you're looking at. So some people, look, there's been a couple studies where, uh, you know, one study where they did two-hour long comedy sessions per week for 12 weeks.
Two
So,
hour long.
so twice a week they watched a 2 hour comedy, did 2 hour comedy
So
sessions,
4 hours per week, and this
4 hours per week, and they showed measurable improvements in heart function and reduction in inflammatory markers. Then there was another intervention where they did therapeutic humor once a week for 4 weeks, where it was like a stand-up comedy session, and that led to improvements. I think the general recommendations are 10 to 15 minutes per day.
Okay.
That's
So,
that's that's the overall uh, that's the overall recommendation. And I mean, this is coming from the Department of Veterinary Affairs, for example, the healing benefits of humor and laughter, as an
interesting.
example.
And so these certified humor therapists, are they basically just stand-up comics, or
No, they're not.
no,
No, this,
no?
no, they're not. So this is my. I've had this discussion with the brass of the AATH. It's like your organization. I'm serious. I mean, the organization. I was sharing a car ride with them back to the airport, and I said, "Look, your organization has done an amazing work of forwarding the legitimacy and the science of why laughter is wonderful, but you need to teach people to be funny also."
Right,
And
exactly.
so to me, like if it were me and I was teaching a 3-year program, I would have at a minimum every single person do a 5-minute stand-up set per year. And
Wow.
then they would perform it at the air quotes talent show at the annual conference. And if they missed the conference, they have to do 10 minutes the next conference.
Make
And
up for it, right?
absolutely, 100%. And it's not, the thing is not to make a tight five. It's called tight five in the comedy industry, your tight five.
Hmm.
The point is not to make a 5-minute set to just repeat to your every patient that walks in the door. That is not a thing.
Not right.
The point is that being funny is not having some jokes at hand. It's a mindset. It's being able to see the humor in any situation. That's what the training is for, in my opinion. Yes, you end up with a 5-minute set, which is great. The first 5 minutes is the hardest 5 minutes.
Sure.
It
Opening lines, right? You're
for
feeling
sure.
your audience.
Now I've at this point, at this point I have probably up to 2 hours worth of material that I've written and performed. 1 hour of that is fully available online, which is
Hmm.
that Neurospicy show I talked about, referenced earlier. And I got about another 60 odd minutes plus or minus of other
Hmm.
material. But the first 5 minutes is for sure the hardest. And it's worth doing because now you've entered into the mindset of and you don't even have to try to be funny. You just have to find the truth. And then you write in a group and they help you find the funny and the truth. And it could
Hmm.
be about your particular practice. It could be about a particular case. It could be about whatever happened in your life or something in the world, whatever it needs to be. And my hope is that the organization pivots to bring in the conscious cultivation of comedy
Hmm.
into their graduates and into their institutions. Because I got up there as one of the rare, doctors who is also a legitimate professional stand-up comic.
That's
And
all. You're right. That's pretty
it's
rare,
it's very rare. And I'm certainly not the only one. I certainly was not the trailblazer.
right?
Man on the shoulders of giants. And Um, but we're not, I don't want people, I don't want people to turn into me to make an hour special. I mean, awesome, more the merrier. But humor is a mindset, and there's another kind of philosophy that you can dovetail on this, that can also help with people who are struggling with their health and their sympathetic nervous system and
Mm-hmm.
their cardiovascular health, is that when you really, really step into the philosophy of comedy, nothing ever bad has ever happened. It's just only more material.
So it's interesting because I've been thinking about it, and obviously there are certain topics that are very triggering to people, and they're really serious topics. But I remember, I think there was a special on one of the channels about what happened after 9/11 and how kind of nation came to terms with a lot of what happened through late night shows that were comedy shows, and and it was
Oh,
sort of.
Jon Stewart's opening monologue was
Yeah.
probably the single most important monologue on in the entire world. That and people should look this up. Jon Stewart 9/11
Mm-hmm.
afterwards.
I
When
actually I did look it up because I remember it was striking,
yeah,
and
it was the most important 3 minute or so I don't monologue about the entire situation that has ever been produced ever, and this is coming from a comedian.
right.
Yeah.
Right. So, how do let's talk a little bit because you clearly have incorporated this. And, I definitely agree with you that, humor is a mindset, right? It's not about cracking jokes. It's about being able to look at the truth or look at the situation with a less serious lens and giving yourself some latitude, if you will, to see a situation as something which isn't as horrible and life changing, but actually something that you can process with with a little bit of a different
I actually
mindset.
forgive me. I'll actually push back on that a little bit. I think I just want to clarify. Like when I say nothing bad has happened, it's only more material. I'm saying that tongue in cheek in a humorous way. I actually think that the best humor is taking on extremely difficult, hard,
Mm-hmm.
harrowing topics, moments, and events, historical or present day, and really, really, really facing them, and not to minimize the seriousness at all. It's actually that's part of why I put the show together, is just how the nature of growing up on the spectrum is incredibly serious given the amount of violence I went through
Sure,
and
sure.
gaslighting, and I don't minimize it. I address it head on, and it's the best humor in my opinion maintains the gravitas of the situation, but points out the perspectives that are true and palatable in a way that people can now walk away feeling more resilient in either identifying the bad situations coming away at a farther distance, or how to resolve the things that's happening within them now, or to help them mourn through laughter the tragedy of what's just happened, and to go forth and be like, okay, I now we resolved to do it differently going forward. And some of my favorite comics, Daniel Sloss, for example, Sloss. His best work for free on YouTube are the clips from his shows and his trailers to his 4 shows, not the kind of bantery stuff he's got. Like I think some of his shows are some of the best comedy out there. He's not even like 30, and he's talked about the death of his sister. He's talked. I'm not going to talk about the other stuff he talked about. Like he talks about some pretty dark stuff.
So that's hard. I
But,
mean, what
and,
you just said, I think, is really hard to achieve. That
yeah,
requires a lot of skill, a lot of sensitivity, a lot of nuance. And I know you sort of, brought this sensibility to your practice model, right? So let's talk about neuroharmony method and what
sure.
does it actually include and how it incorporates this sensibility, to help patients.
Yeah. So the neuroharmony model is it's the updated mind body model where the connection between mind and body is chemistry, and the chemical. When you look at like an amino acid or a neurotransmitter or something, is it physical or is it mental? Is it mental? Like you can't hold, you know, a mitochondria in your. You can't hold like a glutathione in your hand.
No.
But it is there. But it's also just like electromagnetic atoms that are somehow put together in a particular arrangement. And the connection between mind and body is chemistry. So what's been missing up until the past couple of decades to really optimize mind and body is lab testing. So to me, lab testing is that incredible junction point to unite mind and body. And I call it functional medicine. Like, I practice functional medicine. And that is the best of Western medicine diagnostics with the best of natural medicine, lifestyle, diet, nutritional interventions. So we use very fancy Western machines to check genetics, to check mitochondria, to check hormones, to check for hidden infections in the gut, to check for mold, metals, environmental toxins, liver health, whatever, fatty acids, amino acids, vitamins, minerals, all sorts of things.
It's all there.
It's all there. And then combine that with you look at lab testing is looking at your body looking at what's going on from the inside out. Then you combine that with lifestyle analysis, what's happening from the outside in. Now you have a harmonic model. When you combine lab testing with lifestyle, that's when you get a truly harmonic model to help someone go from either chronic to normal or from normal to optimal. It's what functional medicine doesn't really do is get someone from crisis to stable. That's emergency care.
Well, that's more traditional medicine domain, right? From crisis to stable.
Yeah, crisis to stable, that's one part of the sandbox.
Right.
But getting people from chronic to normal to optimal, emergency medicine doesn't really have the tools for that. No different that the tools from getting someone from chronic to normal to optimal, those are not the tools to get someone out of crisis into stable. Right. Obviously there may be exceptions at the edges, but those are just exceptions at the edges.
So how does your focus on humor, right? You mentioned a lot of things which are not necessarily humorous, lab work, genetics, putting it all together, giving lifestyle advice. How is humor or laughter factor into advice that you're giving patients? Like, do you prescribe them to laugh a certain number of times per day, in other words? Is that like, here's Dr. Sam Shay's laughter prescription. You are to laugh, 5 times per day.
Especially with that dry delivery in a serious manner as possible. You are to laugh 5 times. If you laugh less than 5 minutes, if you're 1 second under.
Exactly. You're not going to get the therapeutic benefits.
That patient, So the primary thing around laughter is not actually around the laughter. It's about rapport. And I'm going to mention something that may be surprising to some people to hear, but I've been involved in comedy since 2005, but I really, really got deep into it in 2019 after I read an article on the placebo effect.
Mm-hmm.
The placebo effect is, at its core, how much you like and trust your doctor, how much you like and trust anybody.
Exactly.
And if you're not likable, you'll have worse outcomes for the clients you serve. Because if you're not likable, every time your client or patient thinks about you or a recommendation you made, they will have a cortisol stress response.
Mm-hmm.
And then their results will hit a cortisol-tinged glass ceiling. Now, I have met some profoundly mediocre clinicians who profoundly mediocre.
I need to see if you have a set on profoundly mediocre clinicians. If not, you need to make one. Okay, profoundly mediocre.
I actually have a whole set of medical humor that I'm working on. Anyway, but they all get but some of them have disproportionately, wildly positive results that they should not be getting, and they all have one thing in common: they're also damn likable.
Interesting. Okay.
And then the reverse is also true. I think I'm smart, but there's people out there who's like, their brains are practically like on fire with genius. And maybe that's why I burn all my hair off. But
maybe that's, so that you can get some cooling effect.
To brag,
yeah, so some cooling effect is coming. Okay.
Exactly. But they do not, but their protocols practically glow with genius. And I know they're genius because I can look at them and like, that's genius. And they don't get the results they should because they have the personality of a doorstop. And so when people think about doing the protocols and all these other things, they're like, they have this cortisol response and they don't get the results they should. So when I read that article, I thought to myself, it is a clinical imperative that I be more likable. And that's when I signed up for, I'm serious. And I signed up for a comedy class and an improv class that week. And
So
I
that you
stuck with
become more likable.
correct. It's and I say that it's a little embarrassing to even say that, but it's true. The that and I stuck with stand-up comedy as opposed to improv because stand-up comedy is more my jam. I have nothing against improv, nothing at all. It's just it's a
But
different
stand-up
discipline.
comedy, Sam, it's so scary because, I thought to myself, it seems easy, but it's so
Ah,
actually so hard. And, I'm sure you watch, what is it, The Remarkable Mrs. Maisel, and how she was truly trying to break through. And obviously it was a different era, but it is absolutely devastatingly hard. So, I feel like it's just to even be taken seriously, on that stage, when you're trying
well,
to be a
it's
stand-up
it's hard.
comic.
It's hard for so many reasons. It is claimed to be the hardest uh, public art form
Hmm.
simply because you can't rest on your laurels.
Right.
Like you have bands that are now still touring 60 years later, playing the same songs they were playing 60 years ago, and they sell out stadiums. And if they play one note off of what they played 60 years ago, people get upset. But if I'm telling the same jokes in 60 years from now, I'm
You'll
not
get
telling.
booed. You'll get
Right?
pretty,
It's
pretty
awful. So
booed.
you have to be new. You have to constantly be fresh.
Hi, everyone. It's Dr. Regina here. Many of my colleagues and I are noticing patients coming to us with self-ordered blood tests. When this trend started to gain momentum, I thought it would benefit many patients. After all, who doesn't want more access to health testing? However, I see that self-ordered labs often lead to more confusion and frustration for our patients. Patients are coming in with a pile of labs, and sadly, they're not better off for it. This is why we at Holistic Heart Centers have launched Heartwell Toolkits, a curated collection of blood and genetic markers that one can get at home, focused on heart and brain health, gives you all the data you need to make informed and actionable health decisions. The toolkits can be ordered at our shop on holisticheartcenters.com. You can find the link in the show notes. Use the code TESTING10 to get 10% off and free shipping. So let me ask you a question then on that, because you and I both practice within the sort of functional medicine model, right? And a big
Mhm.
part of the functional medicine model, whether it's applied to cardiovascular or applied to anything else, it doesn't really matter. But the big part of the functional medicine model is being able to tell a patient's story back to them, right? This is sort of one of those foundational training schemas, right? We gather our information, we compose ourselves, we line everything up in terms of these antecedents, triggers, mediators, and then we tell a patient a different story. It's still their story, but now the story comes through the lens of functional medicine. So when you do that, when you tell your patients this story, and you're armed right now with these laboratory parameters or these very sophisticated investigations, are you telling them this story in a humorous kind of way? Like what's your approach?
So part of stand. So when you're doing stand up comedy, 30% is your writing, 30% is how your performance, and 30% is listening. You really have to read the room. It's called reading the room,
Mm-hmm,
and you
mm-hmm.
got to read the room you got to be with the one you're with. And sometimes humor is incredibly counterproductive because they could feel trivialized, or like you're not taking them seriously, or it's about you, or whatever it is. And other times it's like someone is so emotionally distraught about um uh so I'll give you an example. So they're so emotionally distraught saying something, living something in emotion in a lighter way can help diffuse the tension. So, for
Mm-hmm.
example, like I'm an expert in analyzing genetics, and genetics is one of my favorite and most important tests that I run with people. And some people genetically, have won the crappy gene Olympics like me. I was a gold medalist up until about 2-3 summers ago when I got dethroned by some other jerk who had worse genes than me. And so now I'm the silver medalist, and no one knows my names in that Olympics anymore. So anyway, I'm not bitter at all. And so when someone comes to me with a genetics report and it's not good, Like, it's not good.
Mm-hmm.
And I'm not going to lie to them. I mean, I have Asperger's. Lying seems
We
super
don't
weird.
lie.
But I will tell them. I said, like, look, you're in good company. I'm now a silver medalist in the crappy Gene Olympics. Like, here, like, I'll show you mine. So
You can be the gold medalist if you really want to.
no, I don't want you to beat me because I don't like being dethroned. Bronze is even less appealing than silver, but you can try. But here we go. So by acknowledging, we say like, hey, look, I'm a silver medalist in the like, you're in good company. They're like, oh, okay, like it's not they don't careen into nihilistic fatalism that they're in a sea of red and yellow dots on their genetics tests and they're just going to die on Tuesday past the Twinkies. So you can use humor that way. The other way you can use humor is in the reverse case, where someone comes back with, green dots all the way down. They won the genetic lottery and they still have poor health. And I say, I have good news and I have bad news. The good news is that you have actually relatively excellent genetics. The bad news, that your poor health is all on you.
Wow.
You can't blame your parents on this one.
All right. So you sort of.
You can't blame your parents on this one. Your poor health is on you, which is also good news because now you have full responsibility and possibility to turn this around. So, and not to say that people with bad genetics can't turn it around, but like the people with the green dot, it's just faster and easier for them. But I use humor to basically say, hey, great news, you got great genetics. Bad news, your poor health is kind of your fault. So let's look at your lifestyle and take you seriously.
Interesting.
And they laugh when I say they laugh the hardest. It says you can't blame your parents on this one. That's when they laugh the hardest. And it's a sandwich. Like you've got great genes. Your poor health is your fault. You can't blame your parents. It's kind of like a sandwich in the sense that I don't deliver like it's your fault. Like there is some skill I deliver it with, but they get the message. They're like, okay. So your poor health is self-inflicted. Now, I don't say it's your fault. It says your poor health is self-inflicted.
That's a pretty strong statement. Some patients could push back because there are a lot of patients who they feel they're doing everything right. They're definitely making an effort.
But it's in the context of like this is not the first meeting. Like we've done their entire lifestyle analysis. Like a lot of rapport has been built. Like I don't want to seem cavalier given the time constraints we have on a podcast. We're not mimicking a full consult here.
Right.
What I'm saying is that you can use humor to diffuse people's anxieties, but also to wake them up. Wake them up. Like okay. That's what I mean about like have humor as a vector for truth, because it would be irresponsible of me, truly be irresponsible of me. It's like, well, your genes are good. Your poor health, it's like your genes. So your genes say this, so therefore you should be healthy. I don't know. It's all a big mystery. No, like right. Your genes are they're probabilistic. Your genes are not deterministic.
Right.
So people with really good genes can still have terrible health, but they're less likely to do it unless they have a really terrible lifestyle or very terrible life circumstances that have put them into a terrible lifestyle.
Right.
So humor is extremely useful. And it's at its core, it's like, can working with someone in health is fundamentally about truth, because if they lie to me on their intake forms, what they tell me, I can't help them. And if I'm not being honest with them about what these numbers actually mean, I'm not helping them either. Now, I have the other thing about being a comedian and about retelling that you mentioned, retelling their story.
Retelling a patient's story, yep.
So a really good comic says less. The training in good writing is how can you say it as concisely as possible, which is super ironic a statement.
That is so difficult to do.
It's ironic given just kind of the stream of consciousness I've been doing for the past 50 minutes or so. But if you can re-deliver to a client their history and their problem more succinctly than they can, if you can re-articulate it better than they can back to them, that's when the rapport is built. That's when the sympathetic system relaxes. That's when their ears open, and that's when their minds open. And comedy is a training ground to do that. When I wrote my 60-minute special, I had easily 75 minutes of material, and I had to fit it within 6
to cut it.
So I had to just go through and just cut until the most important stuff was left. And even then, when writing the 75 minutes, I had written easily about 600 minutes of just stream of consciousness stuff, of just
Mm-hmm.
and filtering and sifting and blah, 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 blah. It's all just paring down, paring down, paring down. And that is a skill set, to be able to succinctly reflect back what someone told you. And what I really like about the neuroharmony model is that you can combine the outside in analysis of lifestyle and the inside out analysis with labs, and then deliver it with with a sense of serious whimsy, if that makes sense.
Mm-hmm. But you have to be pretty confident and comfortable doing that, right?
Yeah.
And you are 100% correct that this is an acquired skill, because personally, I speak to a lot of physicians who are trying to launch or have launched, integrative functional medicine model, and they're looking to grow within that model. And I can tell you that what you said earlier, that it takes a certain personality, it takes a certain likability, it is very, very true, because, it is every single day. I see exactly what you're saying. There are some practitioners who seem to have a tremendous adoration, and they're not necessarily producing a lot of great results. We don't even know what results they're producing, but they have tremendous adoration because they're very likable. And then there are others who sort of struggle, even though results are great and not as likable. So I think, I would hope that you would develop the neuroharmony model, not just for patient applications, but also maybe to train practitioners how they can learn, to put together their confidence and their ability into communicating with patients or clients in ways that are serious, but they also allow room for humor and maybe for, some levity to in the situation, right? Kind of, and they discharge that whole sort of dark cloud that people often have when they are in an interaction, medical interaction, right? I don't think there's anyone who loves a medical interaction, no matter how great it is, because there's always concern. I just had a patient the other day who is very anxious because of her elevated blood pressure, and I'm trying to make some light of that situation, but it's not easy because those are serious medical issues. So I hope you can maybe train the practitioners one day how to navigate these, difficult areas, these bottlenecks.
Yeah, I hope to teach that as well soon, someday.
Excellent.
It's in I'm I love teaching more than anything, and being a clinician teaches me what I have to teach.
Exactly. So, any closing words here? Any pearls of wisdom that you wish to share with the audience? Anything that they can do by themselves, right now, today, or maybe tomorrow, to really get themselves to a better place health-wise through the power of humor?
So there's two things. One is on humor, and one is that take humor seriously. Ha, ha, ha.
I like that. Take humor seriously. Okay.
Take humor seriously, and that it's one of the few kind of unambiguous positives in life is good humor, and to intentionally incorporate it into your day, particularly if you're concerned about cardiovascular health. The second thing I would say is that if you are concerned about your cardiovascular health, then get under supervision of someone who's a qualified practitioner, and that they can help you prioritize what you need to do, whether it's lifestyle, labs, or both combined, ideally both. And then the third thing I would say is that if you were wanting, if you're just starting out, it's like, I want to get one lab, but I want to make sure I invest well and all the rest of it. I would say, we didn't really talk much about it today, was really look at a really good genetics test, especially because genetics, the data doesn't decay over time.
Right.
And the value goes on for as many decades as you're planning on living. So you amortize it, whatever you invest in genetics today, amortize it over a couple of decades, it's effectively nothing. So, and if you're going to look at genetics in regards to cardiovascular health, and I do, I mean, look at my family history.
Mm-hmm.
I look at the number one genes to look at are not, blood pressure genes. The number one genes
Agree.
to look at are the pro-inflammatory genes and vitamin D receptors, and that there's a
and
hierarchy.
endothelial dysfunction genes, which
Yeah,
unfortunately are highly prevalent.
yeah. So you're looking at genes are in a hierarchy. They're not all genes are created equal in terms of health. And the mistake that most genetics labs put out there is that that they just shotgun all these different genes and there's no organization, no prioritization. So what I want for people to do is to really work with a practitioner that understands that genes are in a hierarchy, and that also that the practitioner has a model for lifestyle. So you want it. So whether mine's like the 10 pillars of health, and other people they have the 7 categories of this, or what the inverted hypotenuse of wellness, whatever. It doesn't matter.
It's very important because I can tell you that we've been doing at the Holistic Heart Centers, we've been doing medical grade genetics pretty much consistently on every patient, because we obviously have patients who come in with cardiovascular issues, high risk of coronary disease or other disease, other cardiovascular disease, or either family history or personal history. And this medical grade genetics has been an eye opener because and what I think a lot of patients, and you bring up a very important point, is that not only do we have to take humor seriously, we have to take heredity seriously, because a gene test versus another gene test versus a third gene test have not all been created equal. And unfortunately, patients very often get they don't understand that, and they go and they grab direct to consumer type of testing, and then they learn that it's not really set up to give them the insights that they're looking for, because the genetic testing is complex. And I am planning an episode on this because there's just so much to discuss, but this is well put. Get in with the qualified people, take humor seriously, and take heredity seriously, right? And that should get us to be in the good place. Dr. Sam, this was awesome. Thank you so much. And please, let people know where to find you in terms of your comedy sets, whether it's a live performance or YouTube link, so that we can share it with everybody. And
sure, yeah, it's easy. If you can put my name into any podcast player, Dr. Sam Shay, and then you can put
you will find the link. We'll put it in the show notes to make sure that people can actually get their daily dose of humor, right, for their heart.
Got it. Thank you so much.
Hi to all professionals listening to us today. If you're thinking of launching a cardiometabolic or integrative cardiology program in your practice, we can help. At the Holistic Heart Centers, we help docs in practice to expand into hybrid or concierge services. Head out to the show notes and click on the application link. Your intro call is entirely free. Ready to schedule a practice review? Use code DOC10 for 10% off our Practice Power Hour 16 minutes coaching session. The link is in the show notes. Thank you for tuning in to Own Your Heart Health with Dr. Regina Druz. This podcast is powered by Holistic Heart Centers. If you enjoy the show, please rate and review us on your favorite podcast platform. To learn more about our services, visit holisticheartcenters.com and subscribe to our YouTube channel. The link is in the show notes. See you next week.